Cancer is not one cause. Not eating sugar, just having fat, extra fat, is related to more than 13 kinds of cancer. It's a family disease. It's not a one-person problem. It's a family problem. Of course, everybody has denial. I never smoked. I never drink. Nobody in my family has it. Why me? Why me? They are in fight or flight mode, They want to survive. The worst part in the cancer journey is the chemotherapy. Everything I have in the pharmacy, all the chemo, everything, I cannot guarantee you're going to be cancer free. I dream sometimes of me having no hair. That's how much I feel my patient. One day if you tell her, I'm going to take off your hair, take off your breast, stop your ovaries, what do you want them to say? You're taking every identity of them being a woman.
There are moments in life when everything changes with a single word. Cancer. A word that carries fear, uncertainty, and pain, yet also reveals courage we never knew we had. Hi, I'm Gayu Lewis, a women's wellness advocate, menopause coach, and the host of the Gayu Lewis Podcast, a space where we have honest conversations, expert views, and a space where women can thrive and survive. Today, I'm joined by Dr. Dima Abdul Jabbar, a US board-certified oncologist with more than 20 years of experience. She is the director of the Burjeel Breast Center in Abu Dhabi and a fellow of both the American College of Physicians and the American Society of Clinical Oncology. Dr. Dima has dedicated her life to treating cancers of the breast, gastrointestinal, gynecological, and prostate systems. But most importantly, she is known for her compassion, her advocacy, and her ability to walk with her patients and her families through the most difficult moments of their lives. Because cancer is never just about the body. It's about families, about sleepless nights, and about choosing hope even when fear feels louder. This is a conversation that you will carry with you long after you hear. So take a deep breath, open your hearts, and join us. Dr. Dima, thank you so much for being here today. I know many people who look up to you not just as their oncologist and their doctor, but more as their strength. And I'm honored to have you with me today.
Thank you very much, Gayu. I'm very proud to be here and to be invited by your podcast. I hope I will be of adding value to your program today.
Amazing. I love to start from the very beginning. Like I mentioned, the word cancer, and suddenly the floor under you kind of just breaks, right? From your perspective, what are those first moments for your patients and their families when you have to break that news to them?
First of all, I don't break this news. They come to me with a diagnosis of cancer. However, the first visit is very challenging because patient is scared. They have 3-4 family member with them, scared. They don't know what's next. They don't know what they're going to do. So I can remember their first visit and visits after and compare it. But I'm not that one. They usually, if they come with a cough, they go to the lung doctor and the lung doctor do x-rays. They tell them, I think you have cancer. Let's do a biopsy. And once the diagnosis is cancer, then they get referred to us. So We do not break the news, but we break other news, of course, bad news. I mean, if they progress, they don't respond. But the first word cancer, we don't break it to them.
Okay.
So they come to me with this confusion. Okay, now how long do I have? Am I gonna die? I have little kid. What do I tell them? Mom and dad, what do I tell them? Husband. I mean, it's a family disease. I call it. It's not a one person disease problem. It's a family problem. So it's a very a difficult situation. I mean, for my first visit, I always make sure we have at least an hour because it's very tough. I mean, you can't come in. You need to know the patient before you discuss anything. So how many kids do you have? So you need to establish some relationship before you talk about chemotherapy, losing hair, all these things. So it is, and sometimes, to be honest, the first visit, it's a way to establish a relationship, and I bring them back again, say, let's come back again and talk about what is the next step. Let's now just give you a general idea, and then we can talk. because I don't think they can hear anything on that visit. And most of the patient, I do write for them the things that we need to do, because they are very confused. I mean, it's a very bad visit, the first visit.
Have you ever had anyone think, like, kind of having denial, like, how, why, I have no history? I mean,
Almost like, this is the start. Of course, everybody has denial. This could be this a wrong diagnosis. Do we need to repeat the biopsy? Could be, I never smoked, I never drink. Nobody in my family has, which is most common, right? Thing that the patient says, nobody in my family has it. Why me? Why me? Which is the most also expression that I get from the patient. I get different. I go through different. Everybody. And actually, if the patient is accepting from the first visit, believe me, this is the one that gonna give me trouble later on. I know that. So the normal experience or the normal expression is why me, angry, denial. That's kind of considered as normal. However, when the patient come to me say, okay, I have cancer, what's next? I feel, oh my God, this is gonna give me trouble later on, because this is not going through the right process of the disease. And then once, even if they accept it in the beginning, all of a sudden they drop off or something happened to them. So,
okay. Is there a lot of people going into depression immediately once they come to know about this?
not really. They are in fight or flight mode, They want to survive. I have kids, I have job, I have family depending on me. They go to depression once they are safe, believe it or not. So, and it's like once we're passing the most difficult part, like chemo, radiation, this and that, and now we are safe, you can live your life. Now they are depressed. And they say, why now? I was fine during the chemo. I was happier. I was very thanking God on every day. I say, when you have a lion running behind you, right?
Yeah.
So what is the first thing you do? You just run. And when you're safe in a safe place, maybe you start crying. This is what you're doing now. You were in a very tough situation that you didn't have time to get depressed. Once you're safe, you feel safe now that you can get depressed and cry and all the normal process. So that's what I'm saying. Everybody experiences different, but we do see patients that they get depressed mainly after passing the difficult part. Yes.
Okay, going back, in general, we hear about cancer every day now, everywhere. In the 80s and 90s, we hardly had that number of cases. Why do you think that the numbers are rising? Is there something that we are doing that's causing this increase?
So first of all, weight gain is one of the most common reasons why we get cancer more. Fat cells, not sugar, not eating sugar, just having fat, extra fat is related to more than 13 kind of cancer. This number one. We have UC compared to 40, 50 years ago. We have more cars, maids. So many things that prevent us from having ideal body weight. And I think this is one of the reasons. The other reason that we can say smoking increase smoking. Smoking, cars, artificial food. So many things, I think this is all related. And plus, people maybe in the 60s, they used to die, nobody knows from what. And now maybe we know it's cancer. So maybe it's a early diagnosis thing. We have more, which is good thing that we are kind of diagnosing disease more. And people live now normal life, so.
Okay. Does stress add on to your chances?
All the studies say no, but I feel it can, because, when you're stressed out, this is my own theory, it's not proven, but when you're stressed out, your cortisol level is always high, your immunity is down. And most of the cancer nowadays, related to your immunity. I don't know. I feel one day we're going to say it is related. You can't prevent stress, of course, but I feel it is related. But most of the studies says no. All of studies. I don't have any study that proves stress related to cancer or to disease response. So even if you're stressed out and I'm giving you treatment, should not affect, whether you're relaxed or stressed, should not affect whether you respond or not. But I believe it does have a direct relationship.
Okay. Because I'm assuming stress, like you said, cortisol increasing and inflammation is,
Correct. I
you know,
mean,
it's
that's
like a direct
right.
correlation
Yeah.
there.
And most of the patient that comes to me, something big happened in their life, just like very short period before they come to me. So I don't know if it's related or not. Maybe we need more studies, but all the studies, again, this is again, if we talk about studies, it's not related. Yes.
Okay. Like you said, now the numbers are increasing because of potential obesity and weight gain and, unhealthy lifestyle habits. Are there anything that people can do from beginning to kind of reduce their risk in general?
Yeah, of course. So I'm telling them cancer is not a one cause. So it's like you're having a glass and you start filling it with stuff, like you fill it with weight gain. Like once it's full, you get the diagnosis of cancer, weight gain. Of course, family history, sometimes it's up to here.
Okay.
When you have a family history, it's already full, right? You have family history, you have strong genes to predict cancer, you're already full. So if you add to it food and weight gain, then you get cancer right here. But if you don't have a family history, maybe you're right here, so it is different from one person, but definitely it adds. If you're smoking, this is a big thing. Unhealthy lifestyle is a big thing. It adds stress to the body. So the body so we get cancer cell every day and the body clean it up, right? So if you don't give the body the chance to clean up your cancer cells by giving healthy food, like if your body is fighting hypertension, diabetes, this and that, I don't know, I have the feeling this also kind of all
contributes.
Yes, of course. But the most important thing is the family history and the genetics. So if you have a gene, you could have get cancer without anything. So, this is the most. But lifestyle, as you add, of course, lifestyle is very important for everything. Hypertension, diabetes, every single disease that we get is because of it's something we did to ourselves.
Yeah. If you've got a family history, how critical is that early detection during cancer important? What are the signs that we should not avoid, irrespective whether I have cancer running in my family or no? What are the signs that the body gives you?
So if you have cancer in your family, okay, you have to tell your doctor, I have, like, for example, my mom and my aunt has, for example, breast cancer. Because at that time, you get checked, even if you don't have any symptoms. Ideally, we should be checked without symptoms. Once you start to have symptoms, this is an advanced stage, okay? When you feel the mass, this is at least like 2 centimeter, which is T2, which is bigger than what we want to find it, you know? Our idea is to find it early enough so we don't want to give chemo, which is the worst part in the cancer journey. Okay, is the chemotherapy. So once, for example, for breast cancer, it's passing 2 centimeter or going to the lymph node, most of the people will get chemo. Okay, so we try to find it smaller, and most of the patient can't feel a lump less than 2 centimeter or 1 centimeter in your breast, and most of the breast tissue is like lumpy, bumpy, so it's not really. So we made the guidelines of 40 years old, right?
Yeah,
you have to do your mammogram routinely every year. Now, if you do have a family history, we may start at a younger age. If you have a gene, we do start at 25 and we alternate between mammo and MRI, different protocols. So this is usually seen by something called high-risk clinic. So if you have, for example, you're a patient, you come to me, you have a gene mutation, for example, a BRCA. The family get tested and you have 2 sisters that are BRCA, but they don't have the disease yet. So they get referred to something called a high-risk clinic, where they get checked every year with different modality because they are high risk than average population. And they get checked maybe for ovarian cancer, depending on the gene, what kind of cancer related to that gene. We do have this clinic actually as well opened, which is related to genetics. So genetics and high-risk clinic is kind of connected. And we do test differently, personalized to the gene and to the age of the person.
Okay. You mentioned about these genes. When you say runs in your family, how many generations are we looking at?
You don't have to. You can. It depends on the type of the cancer. If you say ovarian cancer, you don't need 3 people with ovarian cancer. Okay, 1 person, mom, aunt. This is alarming. If you say male breast cancer, this is very alarming. You say like, I have an uncle or great uncle with male breast cancer. This is very alarming. You don't need, but breast cancer is very common. So you need to have at least 2 in your family, age significant less than 50, for example, first generation. And so it's depending on type of cancer. We do have a category for the breast. So it is the type. So whenever you have a history, just tell your doctor. Of course, you have to have a good family doctor that can relate if this is significant or not, and then refer you to high risk or for genetic evaluation if they think it's related to your genes. And sometimes the patient, they walk in, they say, I'm scared. My mom got diagnosed with cancer, and I have an aunt and cousin and another cousin with cancer. I want to see what should I do now to prevent this from happening. Sometimes patients are smart. Now, where's the problem? Most of the patients, they have cancer, they don't tell their kids about it. Nobody knows in the family. It's just you and your husband. Sometimes even I have a patient who did not tell her husband, and she lost her hair. She wearing the wig all day long at the house. He doesn't know. I mean, how bad it's a stigma for the patient.
Wow.
So knowledge, I mean, it's just like some patient, they are scared. Okay, the kids will be scared that, so if you don't know your mom had cancer, I mean, you're not benefiting your kids. You're not benefiting. I say, at least tell your sister to go check. They don't check. Okay, you don't need to tell your 90 years old mom because she's going to be very sad. I understand that part. But, so it is very culturally difficult to deal with this situation. You have to educate the patient. Okay, cancer is something in every family. It's normal to have cancer. You're going to live a normal life. You need to educate your sisters to get checked. It is an educational process for the family.
You spoke about male breast cancer. Generally, as a woman, you're taught to start, doing self-examination. But men are never told about that. How do they even detect that they have?
They don't need to do but if they feel anything, they need to get checked. Okay. So they don't need to do like mammogram like us. So the women, the mammogram, because they have a bigger tissue, fatty tissue that can be hidden. For the male, it's very superficial. They can feel it right away. So if you feel a lump or bump unusual around your breast, you should go get checked. And this is almost 100% genetically related. So even if you can't find a gene, I think when we do the gene panel, I think we do 47 or more of gene that we know that it's related. But there are genes that we don't know it's related or not, right? Sometimes patients come to me, mom, sister, dad, and everybody has cancer, breast cancer, but they don't have the gene. So what I say, okay, you don't have a gene, however, doesn't mean as a family you're not at high risk. I can't find your gene, but probably maybe 25 years from today, they will identify what kind of gene that caused all of this. So the genes, before we used to know just BRCA1 and 2, and now we have 47 panel that we are aware. Probably in the future there will be hundreds of genes that we can identify patient on.
Okay. And if I don't have a family history at all, is it still necessary or is it good, advisable to go get a gene test done?
If you don't have a family history, if you don't have your own personal history, you just need to do your routine checkup, which is mammogram, colonoscopy, pap smear, regular checkup with the doctor. Just going and get it. The problem is, sometimes patients ask me, if you get the gene, now what? You get more stressed and anxious, and, I don't think it will benefit you more. Unless you have a reason why we need to do, for me, I don't do extra testing unless I need it, because if it comes back positive, then we have to deal with the patient, and you don't want to do that.
Going back to when someone gets diagnosed, they generally feel powerless, right? Like we said, we spoke about the whole denial mode and stuff like that. What kind of lifestyle can they adopt to kind of help them through this journey?
So what part of the journey you're talking about? So our journey is for 10 years sometimes. You know that. Sometimes we give hormonal therapy for 10 years. So it goes into phases. The first phase is the worst phase for me. Okay, chemotherapy, if we need to give, it's during the first phase. This is the worst phase of any patient, okay? is my part, to be honest. And even dealing with later on side effects and stuff is also bad, but not as bad as the first diagnosis, chemotherapy, all of this. So during the first phase, I talk about no lifestyle changes. Whatever you're doing, just keep doing it. It's not going to change. Once you get the cancer, stopping smoking is not going to reverse it, to be honest. I know everybody says you should stop, but it's adding stress on the top of your stress. So the first, I tell them, by the book, I should say, stop smoking, eat healthy. I tell the patient, this is what I'm supposed, and this is what I'm going to type in my note. Patient was advised about healthy lifestyle. But technically, it's not going to change anything. You have the cancer. That's it. You got it. Now we need to deal with it. I want you to focus more on dealing with it rather than on things that are not going to change anything at this point. Once you pass this acute phase, you can deal with lifestyle, definitely. But sometimes, I mean, even patient, they ask me, I said, you can stop smoking, but now you got that cancer. I don't think it's going to change.
Okay. But anything else from, during the chemotherapy, the body kind of starts, losing its, the strength it had. What are the other things that they can do? Like, is there physical activities that help?
So
Any mindfulness activities?
Physical activity is very, very important. It can, add a lot of energy to the patient. So physical activity. Surrounding yourself by good people. Don't listen to bad thoughts and advices. This is very important. Now, keep working. For me, I feel patients who are staying at home and just thinking about future and they're going to die in kids and all, they do worse than patients who are busy and they have projects and, when you have work to do. So if you can keep yourself busy, because this will take your mind away from negative thoughts, Good sleep is very important because anxiety, which one of the questions that most of doctors don't ask, are you sleeping well? Because if you don't sleep well, this is going to affect the whole day, right? So for me, sleeping can increase your risk of nausea, fatigue, and side effects from chemo. So I need to make sure they sleep well. This is very important. Things like that.
Yeah.
But really, eating this, not eating that, the family become very strict on the patient. They kind of make his life like hell. It's out of love, but it's very, tough on the patient. They feel they're sick all the time. Can't eat this, do this, don't do that, wear the mask 24/7. It shouldn't be like that.
So do you ever spend a time just with the family, just to kind of help them say things that they should say or things that they should not say?
Sometimes the family come alone without the patients. And most of the times in the beginning, early stages, they come alone. They want to understand what's going on before they kind of inform the patient or tell the patient. So they are freaking. I said again, it's a whole family disease. It's not one person. So yes, we do all the time. This is the problem here. Like you meet the brother and bigger, and like every 5 minutes there's some new family member that pops up and want to know what's going on, and so yeah,
It's tough for everyone going through this journey. You mentioned about this earlier, so kind of I want to come back to this. You said many survivors, say the hardest part begins after the difficult phase is done or the treatment ends. How do you help them, cope up with this new phase that is coming up, where they've, like you said, the hard part, the chemotherapy, all of that is done. And a lot of people have lost their identity by the time, that the journey that has taken them, the treatment journey. How do you help them cope up and give them that strength and courage?
I don't know. That's a difficult question to be generalized. Everybody is different. But really, sometimes psych support is very important. Psychology, Of course, meditation is very important, whatever their meditation way. They should be meditating. Just having the belief that this is something happened in their life for a reason. I feel this makes a big difference. You see, I tell the patient, every patient should find why this happened to you. Not why in a way, okay, why me? What is this? Why you need this? God put this in your plate because you needed that. You needed a slap in the face, whether you were doing something that's not supposed to do and now you need to stop that, whether you were focusing on non-important things, now you need to know the real importance of life. Sometimes people see, I've never seen how beautiful my hair is, like as simple as that. So it's a phase. It's not your whole life. You're going to lose it's a phase, but it makes you a different person after. And 99.9%, it's a better person, a more grateful person, a more appreciative of the things you have, because, you take everything for granted. We human beings, we take our hair, our body, our nails, everything. Okay, I have this. I want even better, not even happy with this. I want something. Once you get this, you will be minimalist. I feel like you will be happy with anything. And that's, so, I mean, that's priceless, right? I mean, you appreciate so many things that you did not appreciate. And number one thing, you appreciate yourself for going through this and coming out with courage. I feel most of my patients, they are so proud of themselves when they are out of the whole thing. I don't know, everybody, again, and we're going back to how can I support them? Everybody is different, but I feel they learn how to support themselves afterwards.
Yeah, a lot of people kind of reinvent themselves
yes.
And find the courage probably they never knew that they had. And they're
exactly.
like, I've gone through this, what else?
Yeah, nothing is scary now, right?
Yeah.
I mean, there is nothing more. I don't know. It's a very tough journey, and I learn with every patient. So with every patient is a different journey, and you see how much more I can learn, how much more different people, like every patient say, wow, they give you a new way of viewing things. Everybody is different. So it is a nice specialty in a way. It's tough, but it's nice. Teaches you a lot every day. It's like as much as they learn from me, I learn from them.
I have to ask you, how do you keep yourself on a tough day like this? How do you keep yourself away from it? Or you're living their life with you of your multiple patients that you have?
This is a problem I actually want to work on that as well, to keep myself away, distant from a patient. I can't. It's a very tough thing. I mean, oncology, I think, is separate specialty that patient depend on God and you in their life. So it is not easy to separate yourself. Like I get anxious with the result of the scan the same way the patient gets anxious because, I'm going to tell them this tomorrow. Like you have a scan, you want to see if it's good or... Seriously, so many times I get more anxious than the patient because, I want to know what it is because I'm going to tell them, it's not easy telling them, oh, the 3 months I gave you of chemo is not working now, then I have to change it. So it is not easy. We are at the end a human being. Like people think sometimes we are just selling drugs and we are not that. We are human beings at the end. You're trying to help somebody that is drowning and you can't help them. It's not an easy. Do you sit down and cry afterwards, right?
Yeah.
Because you couldn't help them. It's not your fault, but it's not an easy feeling if you can't help somebody that they come to you for help. So for me it's very difficult. I wish I can do this. Then my husband say this is why we can't treat mother and father, because we are attached to them and you need to detach from your patient. You can't do this to yourself. It's draining, but till date I can't do this.
I can only imagine what goes in your mind.
Yes, like you decide for a patient this is the right thing and something happened out of the blue. You can't, what I'm saying, like you decide, okay, this is the best thing and something wrong happened. It's not easy, you're dealing with the whole family waiting for a result, so it is difficult. So you can't detach, you can't. I don't think anybody can.
Doctor, I wanted to ask you this. A lot of cancer patients live with this fear of recurrence. And when you said the whole family again is the whole, it's they're living that same fear. Is there anything that cancer survivors can do to reduce the risk of reoccurrence?
Yes, this is where we talk about healthy diet, exercise, stopping smoking. These are the things that we tell everybody, even without cancer. This is the things we tell them. Of course, taking the medication if they have to do medication. good quality sleep, all of these things to help your body fighting cancer cells if it's there still, So these are the things. Yes, definitely. Yes. With routines, regular screening.
Yeah, I was just going to ask you.
Yeah.
Is like for a normal person, you said yearly, get your pap smears, get your mammograms. Does their frequency increase?
Correct. The first year is usually every 3 months, 6 weeks, depend on the disease and how bad it is. And how much, like some people have side effect more than other people. So I see them more often to address their side effects. Some people, you just need to see them because they need to see you. Psychological support. Like if I tell them 3 months, oh my God, 3 months? You're not going to see me for 3 months? So I say, okay, you want to see me earlier? That's fine. Let's do 1 month or 6 weeks. So it depends, Some people, they don't want to come to the hospital. They have flashbacks. So I try to minimize their coming, 6 months, 1 year, depend on the case, So everybody is different.
And you can never be completely cancer-free. Is that possible for someone?
Yeah, 5 years, sometimes 10 years, depending on the disease. So cancer-free, I can't say I'm cancer-free. Can you say you're cancer-free? We don't know.
You said
right?
every day we've got cancer cells. And
right?
Yeah.
So the thing is, I don't know what is cancer-free means. We do have, we cannot, I say, even if I give you everything I have in the pharmacy, all the chemo, everything, I cannot guarantee you're going to be cancer-free. Maybe in 10 years, 20 years. And all of us do that. Not only for you, for me, for anybody else, right? Yeah. So it is a process. It's a genetic alteration that becomes switched and you can control it and cells start to grow and we need to take care of it. So I cannot determine if this is going to happen anytime or it's not going to happen at all. I cannot. But definitely if you smoke and you still drink alcohol, your chances of getting this is 100% more than a person who doesn't do that. And then people tell you, okay, my uncle smoked for 90 years and he died of no cancer. This is nonsense, It's like saying my cousin doesn't wear a seatbelt and he's not dead yet.
Yeah.
We just need to protect. Death and life in God's hand, but you need to do your homework, right? You need to wear your seatbelt. You need not to smoke, not to drink. It's part of prevent damaging to your cells and mutation alteration,
Okay. Doctor, I'm a women's wellness coach, specifically on the menopausal side. And we all know that as soon as you get into the whole chemotherapy, it's the whole medically induced menopause, right? The hot flashes, the general stuff, it's far more worse for them because it's sudden, unless it's like a big roller coaster that otherwise happens. Is there anything that you advise for women in general to help cope with that sudden hit that happens?
So the younger the patient, the more the side effects, because like you said, you're 30 years old, your hormones are here. I'm just going to make you menopausal here.
Yeah.
Right away, right? While when you are 48, 45, you're almost here. So the drop is not too far. So you can have some symptoms, but not as bad as a young person. I do first educate. So the first thing is to educate the patient what to expect, okay? You can have sleep problems, you can have skin, sexual problems, you can have, so many things that I kind of educate them before. And based on what they have, I treat. I don't kind of give you tons of medication to go with home because you're going to have menopause. Some people don't. Some people, young patient, they do very well. So really, and some people, they are like already menopause for 10 years. And then when I give them the medication, they do bad with more hot flushes. So everybody is different. Okay. I do educate them. And I say, I will give you the medication based on what you have, but these are the most common side effects. Okay. And I deal with it. We start with non-medication first, like for example, exercise, like, vitamin E, evening primrose, stuff like that. And then if it's not helping, then we have a more medical part to it. Like we do have a medication to help with the hot flushes and anxiety and stuff. It's kind of cover it all.
And if it is, if your cancer was hormone related, then of course, then their thing of taking the HRT also kind of.
So HRT is always not recommended. Sorry. Unless you're 30 years old and you don't have ovaries for any other, very, very premature. So sometimes premature ovarian suppression for any reason, you need hormonal therapy for a period of time, but hormonal therapy is always associated with increased risk of breast cancer. So we never recommend hormonal therapy. We never.
Okay. Like even if you have no history, you're saying normal person just go through the regular journey of life.
Yeah, if you're menopause, you're menopause. You just need to make sure your bones are good, checking your DEXA scan, calcium, vitamin D. If you get some hot flushes, we can give you vitamin E and stuff, and even medication. It's better than getting hormones. This is natural life. Your hormones are going down. You're going to get some hot flushes. You're going to get, it's life. You have to deal with it. Unless you're going through this very early in life, sometimes 10 years younger. Some people get menopause at age 35.
Yeah.
So this is the time when hormonal therapy is needed.
Because they're too young to
Correct.
go through that whole change
not
at that
naturally. It's not supposed to happen at this age. It's
okay. You spoke about, you said multiple times that cancer is not just a single person's disease, it's the whole family. What else do you recommend the family can do in the whole recovery and, long-term health of a cancer patient?
First, don't give advices because everybody gives their own advice. Family, don't eat bread, don't eat sugar, don't do this, don't do that. It just makes the patient feel more sick. I don't give advices to the family. Just leave the patient alone. They are more scared than the patient. This can transfer to the patient. Patient can't feel this. They feel they're gonna die, because everybody, if they say my knee hurts, everybody will jump in and take them to the ER because his knee hurts. He's 80 years old. I say, Baba, your knee hurts not because of cancer 10 years ago, They are so overreacting whenever the patient has cancer. So really, I can't educate the whole family. I can't educate the patient first. I should educate the patient before the family. But the family are very emotional all the time. It's very difficult, yes.
Doctor, I was reading about Burjeel Circle of Hope, an initiative.
Yes,
Could you elaborate a little bit more on that? I think that's a wonderful initiative.
Yes, so it is like a survivorship group that we are going to meet every 2 months, 6 weeks, depending. So every now and then. So next event, the first event was September 3rd, next event November 5. And this is just for patients first to give patient hope. See other patients, okay? This is 20 years younger than you that got cancer and now she's pregnant, for example. This is this is that. This is 10 years survivor. This is 5 years survivor,
Yeah.
So just at first to give them hope for the patient and to give power and to appreciate their courage, It's not easy what you did. You deserve I have a patient, really, she was so good during my treatment. I said, I need to give you an award by the end of this. She's so good trying her best. And, it's like school. You feel they are doing so hard to achieve something that they don't even see. At least in school, we see 100 and see marks. Here, they are doing, I don't know, for their family and friends, and we should appreciate that. So I really feel it's a good way of patient to meet each other and to see how other patients are difficult. Like I have pregnant lady now, I'm treating with chemo. I have 20 years old that I'm treating with chemo. This is much more difficult than treating 55 or 60 with,
Yeah.
So it is, it's when you see those patients, you feel, okay, it was difficult for me, but most likely those are more difficult,
Okay. Doctor, you spoke about pregnancy. One of your, patient is pregnant now. So when someone is young, can you retrieve eggs at that time so that they can get pregnant later?
Yes, of course. So even if the patient comes to me and say, I don't want kids, I have 3 kids, I say, I don't care, you go to fertility doctor. Okay, especially if they are in this childbearing age, okay? Because, so not all the chemo it's not going to kill the ovaries. Most of them, they go back to normal, but there is a small chance that it can prevent your ovulation in the future. So I have to send them to fertility every time they get, if they are in this childbearing age, not if she's 55, even if they say, doctor, I don't want, I say, please go, because I don't want you to come back and say, oh, I didn't do it. Something happened, or through, life change. In 5 years, you decide to have another baby for any other reason. So please go and do it. So yes, they should do it. And I've seen patients that go through chemo without even doctors mentioning this to them. So I'm very surprised. Everybody should get a fertility counseling before any chemotherapy.
Okay. And you said you've got currently somebody who is pregnant.
Yes.
Does chemotherapy affect the embryo and the baby?
Definitely, if it's very early, before 12 weeks, yes, we can give chemo. Sometimes we advise abortion, and I've done it, some of my patients, where it's very early. Let's do abortion, deal with it after. If you have a mom with this big tummy, you can't kill the baby. And there's studies, I mean, we do have many patients we treated before. It's very safe. Baby comes healthy otherwise. So after 12 weeks, usually healthy. We prefer to wait more, but it's normally studies that show there are some medication we can't give because cross the placenta, but most of the medication we do. I actually just had an award. We name it as 2 Hearts in 1 Fight.
Oh, amazing.
Award for a patient who's pregnant. This will be for the next Circle of Hope. Pregnant, going through all of this. So it's just, they deserve it. They deserve to be recognized, you know.
And the baby, once the baby is born, you have to test them for the BRCA genes?
So if they don't have the gene mutation for the mom, it doesn't go to the baby. Now the chance is 50-50. Not every baby gets it. And then it's not at their baby stage when we check them. It's the young,
later. Okay.
20s when we check them, because you don't want to get anxiety as well at younger age.
Yeah. I mean, yeah, then the parents are always in that stress mode, like you said, something can happen.
Yeah.
Okay. Doctor, for anyone listening right now, maybe they've just been diagnosed or they're supporting a loved one, what message do you want to share with them?
I feel this is always, I mean, I don't want anybody to get cancer, but it's always turned to be a positive things happened after. You know, it's always the phase, you know, where you are not doing well and this, but afterwards something change. Most of the every patient can tell you a story, what happened. Some people, they were about to divorce, and once this happened, they decided to stay together and they are happily ever after, you know. Some patients, they wanted to go somewhere, this happened and they prevent them from going, and you know, your priority change after this. You really see life the way it is, the real life, not the fake life that we live in. Sometimes I feel like we don't have a real look of what, I mean, in the hospital, we do see them every day, but this is real life. Real life is not on the TV, not on Instagram, on social media. Real life is in the hospital, wars, poor people. You know, this is real life. This is 80% of everybody, right? The people think real life is the social media and the restaurants and the brands and the bags, right?
Yeah, that's as fake as it can be, right?
This is not real life. So at that time, these things start not even touching you. You do see the real life. Real life, you're healthy, your kids are healthy, you can walk, you can eat, you have hair, you know, like it's different.
Yeah. You mentioned hair multiple times, and I know that anybody going through chemo, the first thing that they start losing is hair, right?
So hair, I mean, I dream sometimes of me having no hair. That's how much I feel my patient. You know, I have in my dreams that I am bald just because of them, because I feel how sometimes it's painful, especially for the young patient. You know, women, how do they identify a woman? How do you say this is a woman, this is a male? By their hair, their breast, right?
Yeah.
And then you come to a lady one day and you tell her, I'm going to take off your hair, take off your breast, stop your ovaries. What do you want them to say? You know, you're taking every identity of them being a woman. And the first thing is the hair, because this is what you see yourself in the mirror. So it's not an easy thing. Maybe this is the most difficult side effect in chemotherapy. And if we can solve this problem, most of patients will have much less problem. That's why cold cap, everything come in. And I feel if we can stop this hair from falling down, most of the patient won't feel the pain as it is.
Because this is something that they see directly, right? Something that they can visually see. Imagine the impact that they have it on their...
Especially the female. And believe it or not, male also care. Like an 80 years old comes to me, would I lose my hair? I say, oh my God, you're 80. What do I tell the 20 years old, you know, in my heart? Am I going to lose my hair? He has 2 hair. It's not even a full...
full head of hair, yeah.
So it is important for people, even if they are 80 years old, you know.
So you mentioned about the penguin cap, the cold cap. So that kind of numbs your the hair follicles, and then the
So
chemo.
it frees your hair follicles so the chemotherapy will not reach there and prevent the hair from falling. Doesn't work for all the patients, but some patient does work perfectly.
Okay, amazing. And like I said, on I had to ask this question on days that feel very heavy for you. What is it that you do to kind of cut off? Do you sit, meditate, maybe laugh with your family? What is it that you do to just? I'm sure there are days where maybe you lost a patient, or there are days, I'm sure, for you. What is that you do? Like any lifestyle ritual that kind of helps you come back and start the next day fresh?
What do I do? I mean, of course, praying is very important. First of all, I have deep feeling that every time I help a patient, this is going to prevent me from needing, this karma, like you say, that it is coming back to me. So that makes me feel, okay, when I'm helping, it's for me, not for them. When I'm giving. So that makes me feel happy. Like sometimes I sit down and say, if I'm not the doctor who I am, I have no identity. So I identify myself as a doctor giving, helping. So this is my identity. So I love my job. This is the most important thing. Now I get tired sometimes. I sleep, I recover. Next day I'm energetic. But really, I don't hate. I've never come to the point where I hate my job. I want to do this until I'm 70 or 80. I want to retire, but I will still want to do maybe volunteer job or helping people, because this is how I identify myself.
Totally agree. Doctor, 99% of my podcast is about women.
Okay.
But men are a part of our lives too. So we've dedicated 1% to them. So what is your 1% advice to the men in our lives? What can men do to support women, especially when, they're going through a difficult phase or journey in life?
Sometimes shut up. Don't say anything. Sometimes we don't need advices. It's as easy to give advices. They think sometimes when the women talk or complain, she does not want somebody to give her advice. She wants somebody to listen. They need to understand this part. I mean, you don't have to give advices every time, but don't do the shut up thing. Let's repeat it.
We keep the shut up. That is the originality. That's natural. That came out.
Seriously, sometimes I see patients, like wife and husband, they come in and the patient has been given advices and he's complaining that she's not listening to him. Excuse me, she's in tough part. Just leave her alone. Just be a good listener and just let her express what she feels, and either say something nice or don't say anything, So they feel their job is to give advice, but we don't need the advice. They don't need the advice at that point. They need you to listen to them. They are going through a tough period. Just listen to them and you're right. I don't know how you can do it, this and that. Don't say, I told you should sleep well, or I told you should do this, or how many times I told you not to smoke, or whatever, whatever their advice will be. So I don't think this is helpful. And this is part of men, like they're trying to give advice to them, and they are in tough time.
So just listen and don't shut up.
Yeah, exactly. Listen and just make her feel that you're feeling her pain. I think that will be much valuable, to her than just giving advices.
Okay. Dr. Dima, any parting advice to our listeners? Any piece of advice that you want to give them as maybe an oncologist, or as a woman, or as just a human being?
If you are afraid of something, just go and face it. This is my theory in life. If I'm afraid of anything, I face it. I don't hide.
You face your fears.
Yes, if you have something in the breast and you don't want to check it because you're afraid that this could be cancer, just go and check it. 75% becomes benign. And patient tells me, I've been having this for for a year or two and I've been scared to come and check it out, So it's either it's benign and you're done with it, or it's malignant and you have to deal with it. So if you have a symptoms, please go and check it. This is my advice. I mean, nobody can be perfect. All of us has our own bad stuff that we do. Try as much as you can to be healthy. I mean, we all do bad things here and there. But as much as you can, you try to be healthy, you try to exercise, it's easy to say exercise is healthy, this and that, but it's not.
You've got to take the effort to do it and understand that that's going to help you in a long term.
Meditate is very important. Be thankful every day. I feel this is the most important. You wake up every day, you say, thanks God for everything I have. And you name it, you name even the hair. You can walk to the bathroom. Seriously, I have a patient, he was so rich that he had a private jet. Okay, he said, doctor, I have a private jet. He had like a knee problem at that time. He couldn't go to the bathroom. Okay, so he said, like, you know what, doctor, take all the money I have and just make me go to the bathroom. And he could not go, not because of cancer. He couldn't go because of his knee problem. So really, how important just like you going to the bathroom by yourself, you don't need help for simple things. So we should be just grateful for everything, for everything God gave us.
Amazing. And doctor, where can our listeners connect with you?
Instagram, through the clinic, I guess. I do have a website as well.
I want to thank Dr. Dima for sharing not just her expertise, but her heart with us today. Conversations like this remind us that behind every diagnosis is a story, a family, and a fight for hope. If this episode touched you, please share it with someone who might need that strength, comfort, or simply a reminder that they are not alone. You might never know what a single share can do. I'm Gayu Lewis, and until next time, menopause, why pause? Let's play.